public around understanding about attending an A&E. But just as an anecdotal comment, my son, who had an infected toe over the Christmas period, was when we tried to access GP and the nurse and the drop-in centres, were all too often directed towards an A&E department. So I think there's certainly some education around staff and possibly work to be done around that area. I'd just like you to know I didn't attend an A&E, but we managed to get it sorted in the end, but it did take 3 weeks, but there we are. My other 2 questions. I'd like to know exactly where this puts us in a national picture in terms of A&E waiting lists. I'm not sure I got that clear anywhere. But I also note, in answer to Councillor Brown's comments, where he suggested that this was too little too late, sitting in numerous meetings of this type, asking very clear questions around capacity pre the Hammersmith hospital closure, and constantly being told that there was absolutely everything was in place and there would be no impact. I would like to know your comments on that, please.
So, in terms of where it puts us nationally, so our year-to-date position from the 1st of April to the 18th of January in terms of our performance against the aggregate 4-hour target, I think we are running at 94.1 against the 95% target if you take that year overall. I think nationally the country in England is running at 94%. So kind of our position year to date is broadly tracking at the national level. So that's just the context at the moment. In terms of the assurances that we gave around the closure of the Hammersmith EU, I think we gave those assurances because we genuinely believe the things that we were putting in place were going to be sufficient for both the Hammersmith EU closure and then subsequent consequences around the seasonal changes, seasonal variation that we see as we go through into November and December anyway. So increasing the emergency ambulatory facilities on all of the sites, the additional bed capacity above and beyond any winter capacity at St Mary's, and movement of senior decision-taking staff from Hammersmith to Charing Cross and to St Mary's were all things that we absolutely believed were the right thing to do in terms of making sure that those sites were also resilient. I think it's worth me just finishing on, and Bill may want to add, but we would still wanted to have closed the Hammersmith EU. We were very open and been very honest with you here as a committee that we believed for some time that we were not running a safe facility. It was not run by emergency consultants or juniors. It was not a consistent location where we could provide safe emergency care. And regardless of any of the other North West London arrangements, we would have wanted to have closed that facility and would have had to close that facility because it wasn't viable going forward. So have we got it absolutely right? Clearly not, because the performance is not where it needs to be. Do we think that closing Hammersmith EU is the right thing for clinical safety reasons? Absolutely. And will we do it again? Absolutely.
Can I ask a quick follow-up?